Annual enrollment is here. And just like every other day of the year, Employee Benefits is ready to help you. Meet Joe Walsh, the city's Parks and Recreation Director. Joe says he has a fun job. As the city's Parks and Recreation Director, he encourages the people of Knoxville to be active, just as we want to encourage you to get active and stay healthy. Retiree packets were mailed October 23rd. Hopefully you reviewed the information, but let's take a minute to explain the changes in greater detail. While there are no changes to the medical or pharmacy plans, there is a change in the networks that will take place March 1st, 2016. The University of Tennessee Medical Center will no longer be participating in Network S. Before you enroll in benefits, it's important to ask your doctor if they will be an in-network provider under Network S. Remember, care in a non-network facility due to an emergency does have in-network benefits. Since there are no changes, let's jump into a quick recap of our current benefits, starting with medical. Not much has changed with choosing your plan. First, you select your network, either Network S or Network P, keeping in mind that the University of Tennessee Medical Center will not be participating in Network S, effective March 1st. Next, you select which deductible is right for you and your family, $500 or $1,000. Finally, you need to decide whether you want to participate in the MyHealth Wellness Rewards program or not. Here's a chart with the basics of our plans side by side. Notice that both plans cover preventive services at 100%, and both plans have the same out-of-pocket maximums. Here are your medical premiums for 2016. The total premium is increasing by 3.3%, with the city and the retiree sharing the increase. The cost share did not change. The city pays 35% of the total premium. By now, you should be pretty familiar with the MyHealth program and understand the rewards and requirements of the program and how it can benefit you. But don't take my word for it. Check out your coworkers and their experiences. They are staying active. Officer Sutton appreciates that the city rewards him for being active. He's a big advocate for physical activity, any way you can get it. They are focused on nutrition. The Edwards decided they wanted to be parents that led by example, and they're making lifestyle changes that have a big impact, not only on them, but on their entire extended family, too. They are losing weight. Julie Maxwell has tapped into the resources of the center to lose weight and keep it off. She couldn't do it without the support and encouragement of her health coach. Most people join MyHealth for the reduced premiums, but they also have access to free or reduced prescription copays and earn HRA dollars that can be used to pay for eligible medical, dental, and vision expenses. The HRA dollars are designed to give you money throughout the year to help you pay for any eligible expenses. MyHealth participants with retiree-only coverage receive $32 a month. If you have one or more dependents, you'll receive $64 a month. You may also qualify for additional HRA dollars through the prenatal benefit as described in the chart. You can use your HRA dollars to pay for qualified medical, prescription, dental, and vision expenses incurred by you and your eligible dependents. This includes out-of-pocket expenses that count toward your annual deductible, copays, coinsurance, and other eligible expenses. Not all expenses are eligible, though. You can visit wageworks.com for a complete list of eligible expenses. This web address is listed in your 2016 Guide to Your Retiree Benefits. Those HRA dollars we keep talking about roll over, too. If you don't spend all of them during the year, they roll over to the next and are available to you as long as you remain covered by a city-sponsored medical plan. So, naturally, to get all of the rewards, there are a few requirements for you and your covered spouse or qualified domestic partner. First, you must receive an annual health screening. Be physically active and complete a monthly physical activity affidavit. Now you can do it from your mobile device through a new Blue Cross Blue Shield portal. Complete quarterly health education, which can also be done on the new portal. Manage any chronic conditions by meeting with your health coach, including tobacco use. And seek an annual WellCare visit for your covered children. If you don't meet the requirements of the program, you will be removed from My Health and miss out on all of the rewards. It's all about being active and aware and then recording the results. The AUBs don't look at the requirements as a burden, but as a seed that's been planted to help them enjoy life and their family. If you choose not to participate in My Health but still want city-sponsored medical and prescription drug coverage, you can enroll in the medical-only option. Medical and prescription drug benefits are available for medical-only participants, but you'll be paying more for coverage because you won't be receiving the My Health discount. And there are no built-in rewards, such as HRA dollars and lower prescription drug copays. My Health is more than activity. It's a program that focuses on your and your family's overall well-being. We couldn't have said it better, Mark. Your prescription drug coverage is part of your medical plan. Our vendor is Optum Rx, and there's a separate ID card. Use your Optum Rx card at the pharmacy to pick up prescriptions. Every year, our prescription drug vendor may make changes to the formulary drug list, which may affect where your drugs fall on the copay list. If anything changes, they'll let you know. Make sure Employee Benefits has your current mailing address, and pay attention to your mailbox in November. That's how Optum will notify you. Take a look at the next slide to see the copays under our plan. Here are the copays for prescription drugs. Remember, if you choose My Health, you'll not only receive discounted prescription drug copays for medications used to treat chronic conditions, but you will also pay lower copays for non-preventive brand medications as well. Refer to the drug list at cityofknoxvilleRx.com for a list of commonly prescribed medications. If you have questions about your coverage, please call City Benefits at 215-2111. We're here to help. The Center, the city's health and wellness clinic, is a valuable resource for our employees, retirees, and their covered dependents. As long as you are covered under a city medical plan, you and your covered dependents can use the center. But My Health enrollees receive services for a lower copay. If you're sick, call the center to make an appointment. The center is located at the temporary location off Mineral Springs. We are all very excited to move to the new Public Works Complex upon completion. Stay tuned for more information. Now it's time to enroll. You have until November 30th to make your 2016 benefit elections. Enrollment packets were sent to all retirees on October 23rd. To remain covered on the plan, you must return the Medicare affidavit. The enrollment form and spouse surcharge form only need to be completed if you're making changes, like adding an eligible dependent. If you do not complete the enrollment form, your current changes will continue. However, please take a moment to include an email address for our records if you have one. And make sure we have a current mailing address for you. This will help us communicate with you better. Everything we've talked about here is in your 2016 Guide to Your Retiree Benefits. And as always, the guide is available online at knoxvilletn.gov/benefits. And if you have any questions along the way, Employee Benefits is here to help.